In this procedure, you will learn how to position and drape a patient for examinations of the head, neck, and chest, or for patients who have difficulty breathing when lying flat. Greet and introduce yourself to the patient.
Good morning, Jennifer. I'm Julie, Dr. Anderson's medical assistant. Before we get started, can I get your name and date of birth?
Sure. Jennifer Jansen, June 23rd.
Then confirm the patient's identity using her name and date of birth.
Great.
Sanitize your hands.
So have you seen Dr. Anderson for this neck problem before?
No, I haven't.
Okay, well, the exam is really pretty simple.
Determine whether the patient understands the procedure. If the patient does not, explain what to expect.
And so in order to facilitate this exam, I'm going to be getting you into the right position for it, but I do need you to put on
Give the patient a gown. Tell her to undress from the waist up and to have the gown open in the back. Provide assistance as needed.
I'm going to give you some privacy to do that.
Thanks.
Give the patient privacy while changing. Knock on the examination room door before re-entering to make sure the patient has completed undressing and gowning.
I'm ready. Come in.
I'm going to raise up the head of the table just so you can be a little more comfortable during the exam.
For Fowler's position, elevate the head of the exam table 90 degrees. If the patient feels more comfortable, she can sit at the end of the table. Extend the table extension as needed for patient comfort.
So you can sit back or sit just at the end of the table, whichever is more comfortable for you.
The patient may be more comfortable in semi-Fowler's position. In this modification of Fowler's position, the head of the table is elevated 45 degrees. Semi-Fowler's position may be used for post-operative follow-up or for patients with a fever, head injury, or pain. It also is a comfortable, supportive position for patients with breathing disorders.
I'm going to get a drape to put across your lap.
To provide her warmth and privacy, drape the patient according to the type of examination and the required patient exposure.
You did great, Jennifer. I'm going to leave Julie here to finish up.
Thanks, Dr. Anderson.
All right, since we're all done now, I'm going to have you get off the table and you can go ahead and get dressed. Do you need any help with that?
Probably just getting off the table. I can get dressed myself.
All right.
After the examination has been completed, assist the patient as needed to get off the table and get dressed.
Sit up. There we go. And go ahead and help.
Before cleaning the exam table, put on a pair of disposable gloves. Dispose of used examination table paper according to facility policies. To prevent the transmission of pathogens from one patient to another, use disinfectant wipes to clean the exam table and all potentially contaminated surfaces. Then dispose of your used gloves. Once the exam table is dry, pull clean paper over it. When you're finished, sanitize your hands. Follow up with the provider's orders regarding scheduling of diagnostic studies, collection of specimens, and/or scheduling of future appointments.